We certainly see a lot of flea and ticks because the seasonality of those type of problems. So fleas can provide plenty of things, but a lot of times it's pruritus or itchiness over the dorsum of the tail and can be quite nuisance to the pet and to the owner. That's a good question. They can find them, and so they can actually see them. Sometimes they're hard to see, but they can. The other thing is they can take their dog to the veterinarian. So check with their local veterinarian. They do a good thorough exam. They can typically find clues or potentially some evidence that there is a flea somewhere driving the patient crazy. Basically on the physical, everybody does them different, but for fleas, and more in particular, I'll concentrate right above the dorsum and spread the hair across, looking for any evidence of fleas or flea dirt. And then also on the back hamstrings, I'll look like this, and just looking across their skin and their hair for any evidence of fleas or irritation. Yeah, they can. They're typically, depending on if they're allergic to the flea, they're typically itchy no matter what. So the owners will typically find their animal scratching when they're never used to, or chewing, maybe licking above the tail or underneath the tail. And then, of course, there's a problem with flea allergy dermatitis where they're intensely pruritic, gnawing themselves red, raw, even to the point of just basically traumatizing their skin. Yeah, so once we diagnose it, there's a variety of flea preventions that we integrate into basically their year-round parasite prevention program. So there's so many choices out there, from pills that are once every 3 months, to a collar that's excellent, that's good for every 8 months, to topicals that are good for once a month. So there's plenty of options, and you usually can tailor it to the needs of the pet or the need of the owner. Cats get fleas just like dogs, and actually the cat flea is the most common. However, cats sometimes show a different form of skin disease with their fleas. They get sometimes just a miliary dermatitis or a rash in places around their neck or on their face. They're treated just like, in some cases, just like dogs. We have oral types of medications and topicals and collars as well. But certainly I would think fleas are greatly underestimated, the amount that we see and the amount that we catch. So your dog or cat should be on year-long flea prevention for sure, especially in the South.